My name is Dawn Guy, and I am the instructor for the Fast Track Healthcare Program. And this is an information session that we do to tell you all about the program and what you need to know to get started and what happens once you're accepted into the program. Gives you a chance to ask questions so that when you leave here you feel comfortable about what you need to do to register for the program and what the program entails, okay? So the first thing I'm going to do is show you the PowerPoint, and then after that I've got a few handouts that I'm going to give you to go over some of the information, okay? Now hopefully I won't turn all the lights out on you, but I will adjust it a little bit. Sometimes I do this and it completely goes dark. All right, so just what is the Fast Track Healthcare Program? It's a program that's going to enable you to become a certified clinical medical assistant, a certified phlebotomy technician, and a certified Ekg Technician. How we came about this program was in 2017, they asked if we would come up with a medical assistant program because there was a need in this area for that type of program. And when I looked at the pass rate for certification in the state of Virginia, the pass rate for the certifications was only 67%, which is not very good. So in looking at what the class entailed, I was already a phlebotomy instructor. So I knew that you could have a phlebotomy class, and then there was also an EKG component, and there was an opportunity to be certified in EKG. So what we did was we pulled out phlebotomy and we pulled out EKG and have them as a separate class within the class. And the last class that I graduated in 2020, we had a 100% pass rate. And prior to that, our pass rate was about 92%. So pulling those two out and having them as separate classes seemed to really increase the pass rate of the scores for people becoming the certified clinical medical assistants. As well as it gives you an opportunity to earn your certification in other areas and makes you more employable. So if you can't find a job as a certified medical assistant, which there's lots of them, you can work in these other areas. And with all of these credentials, you can expand just outside of medical assistant. So you can go to the hospital and work as a nurse care partner. You can work in the emergency room as an emergency tech. There's lots of opportunities out there other than just a medical assistant in a doctor's office. So having those will help you. Now, if there's anybody in here that's just interested in taking anything by itself, we'll talk about just taking it by itself in just a few slides. Okay, so this particular class we call the fall class, but it actually starts in July and runs to December the 10th. All of the classes are online. The classroom material is online, with a hands-on portion to be held either daytime, will be held here in this building, or in the evening in Suffolk. So we've given you a little bit of opportunity. So there's some people that live in Franklin that would rather do Franklin, and there's some people that would rather do their skills during the day, and there's some people that live in Suffolk that would rather do Suffolk, and there's some people that work during the day that want to do their hands-on in the evening. You will have one day during the week that you will come in and you will do your hands-on part of the class. So everything else will be online. You will work at your own pace. It will not be that you show up online at a certain time like the kids are doing. You won't do that. It's already loaded into the computer. You will have your due dates and you will work at your own pace to complete those. Now from time to time there will be mandatory Zoom meetings where I will give you an opportunity to meet with me via a Zoom meeting, but I will give you different time frames to attend those meetings, or we'll have study groups, but otherwise you won't see me or Miss Pierce, who is my assistant. You won't see us unless you do hands-on, when you come to the hands-on class. So everybody wants to know, how much is it going to cost you? So the tuition for the 3 certifications together, which is what we call the bundle, you'll hear that referred to as the bundle, is $5,000 for the 3. And in that tuition, it includes textbooks, your CPR certification for 2 years. It's a healthcare provider CPR. Your online and paperback study guides, practice tests, and your first certification test. If you were to purchase the study guides, the practice test, and the certification, it would cost you about $500. So that's all included in the tuition. So we give you your first test and all your study material. Soft skills training is included, and we'll talk about that in a little bit. Your lectures and labs, your externship. So you will be doing 2 weeks at a doctor's office, as well as 2 to 3 days in a lab drawing blood. And then your assistance with your career building and job placement is all included in your tuition. Other financial responsibilities are, a background check is $15, and they've added another $15 fee, so what you pay is a $30 registration fee that you pay when you turn in your application, and then you have a $25 drug screen fee when you go to do your drug screen. So altogether, out of your pocket, it's going to cost you $55. And we're going to talk about how you're going to get the $5,000 paid for in just a few minutes. If you were to pay for these classes individually, so say there's somebody that just wants to take phlebotomy, it's going to cost you $2,300 to just take phlebotomy. If you're going to take just EKG, it's going to cost you $1,800. You have to meet all the same requirements as you do for the bundle, but for EKG, you also have to be a healthcare professional already. So you either have to be a nurse or a CNA or a PCA in order to just take EKG by itself. We used to offer it by itself, but what we found was people are not hiring just an EKG technician. You have to be something with your EKG certification. Now, you can work as a phlebotomist by itself, but you can't work as an EKG technician without being some other type of healthcare professional. So it's no need for us to put you through the class when you're not going to be able to get a job unless you take the medical assistant program. And so then it just tells you, when we break it down with having the bundle, you have the CMA is $3,000, the phlebotomy is the $1,500, and the EKG is $500. So you're getting a discount on the other 2 classes when you're having it bundled. But in order to take CMA, you have to take phlebotomy and EKG because that's part of being a CMA. So the financial assistance that you have, right now is a great time to be going back to school because there's lots of financial assistance to pay for your program. So right now, the Workforce Development has what we call the Fast Forward Workforce Credential Grant, and it helps to offset the cost of the program. So how it works is, you pay a third of the tuition, the state pays a third of the tuition, and then once you receive your certification, the state pays the other third of the tuition. So you're responsible for a third of the tuition, which comes out to be $1,666.66. The state will pay up to $3,000 of your tuition. So your responsibility is that $1,666. And so then these other funding agencies come into play to pay that $1,666 for you. So Fantic, they usually pay 90 to 100% of that money that's left, that 1/3, and right now they're paying 100%. So a lot of my students that I currently have use the Fantic. So right now I have about 55 students. And those 55 students, nobody paid anything to attend class this time, because they were able to get the workforce grant, and then they were able to be covered by FANTIC, or they were covered by the Virginia Career Works. Virginia Career Works is for the adult dislocated worker, so if you're unemployed, the Virginia Career Works will pay the entire tuition, the whole $5,000. If you are 24 years old or younger, the out of school youth grant is a great grant if you qualify for it. They will not only pay 100% of your tuition, but they will also pay for your uniforms. They'll pay for gas to get to class. They will also pay for, when you're in your clinical experience, they will pay you $8.50 an hour like you're working. So if you are within those ages, we will refer you to that coordinator, and she will see if you qualify for that grant. There's also the Virginia Horseshoe Initiative that helps to cover up to $2,000. And then the Housing Authority, we hear, has money to help you with paying tuition. And we have had the Department of Social Services pay for some of our students to attend school. And we have had the Department of Social Services also help students pay that, that money that I told you had to pay at the beginning, the $55. We have had some students that have gotten that, some assistance with paying that money too, that are working with social services. Now, once you've been accepted into the program, you're going to receive a letter, and it's going to include all this information for you. But now is the time to be gathering this information, because this is what the holdup usually comes into play. So you're going to need your driver's license or some state-issued card, your social security number. Guys need to be enrolled in the selective services. If you have a current SNAP or TANF card or a letter, that automatically qualifies you for your benefits. So if you don't have that, you need to go ahead and get that, a copy of the letter or the card, because once you show that, that automatically qualifies you. Your tax transcripts, your W-2s, or your last 3 pay stubs. So right now it's tax time, and we're gathering all that tax information. Keep that handy, because the ladies in the front office are going to ask you for that information. High school transcript or your GED, they're going to have that. So now is when you need to be looking for that. Then you're going to go online, and you're going to create a profile, and you're going to read and sign the fast forward agreement, and you're going to bring that with you when we have a registration session that will be set up for you. So when you get your letter of acceptance, it's going to have this information in it, and you're going to want to complete all this prior to coming to the registration session so that you can get registered. They can tell you what you qualify for, and then you can complete your registration process. The problem comes in is when we get to this point and people got to run around looking for stuff because they don't have it handy. And then it just prolongs you getting the funding. Right now, we're in a good spot because there's lots of funding. But when the funding starts running out, then it's first come, first served basis. So you want to have that stuff handy just in case the pot starts dwindling down. Okay, so what do you need to do to get accepted into the program? So you have to be 18. And you have to have your high school diploma or GED. You have to pass the background check and the drug screen. You have to complete your application. You have to have an interview with the healthcare instructor, which would be me. So you'll sign up for an interview. And then you need 2 letters of recommendation. They need to be from non-family members. They need to include a phone number or an email address And I do that because I have had some people try to write their own recommendation letters. So if I think that it might be something that somebody has written themselves, I may follow up with it. So it needs to include a phone number or an email address. You can bring it in to the Workforce Center and we will put it in your file, or you can email it. And at the end of the presentation, there'll be an email address that you can email it to me, and then I will place it in your file. Once accepted into the program, there are clinical sites that require these immunizations. There are some that require them and there's some that don't. So if you have access to these records of immunizations, you need to gather those, just in case you have to go to one of these sites that needs a record of these immunizations. So some places ask for a PPD within the last year. A lot of people that are already employed will have a copy of that. Your varicella or your chickenpox vaccine, hepatitis B, your MMR, your Tdap, and then your flu vaccine. And because of the time of year that we'll be having this class, it'll be flu vaccine time of year, and you'll either show evidence that you've had the flu vaccine, or you will fill out a form that you're declining the flu vaccine. And they haven't addressed the COVID vaccine yet, so we'll just cross that bridge when it comes. So if you happen to be at the health department or go by the health department and get a list of your shots so that we have those on record, we'll put those in your file, and if we need them, then we'll use them. We'll look at them and see if you need to get up to date on anything. And then you have to attend the mandatory orientation session. So if you're going to be in the daytime skills group, it will be July the 15th, and I'm going to give you a piece of paper that's going to have that on there, from 9 to 1 in this room. And if you're doing the evening group, it'll be from 5 to 9 in this room on July the 15th. Now, it's very important that you be here, and I say that you'll forfeit your seat if you're not here. If I don't hear from you that you have a really good, legitimate reason for not being here, you will forfeit your seat into the program if you don't show up. Because this is the time that we go over your handbook, this is the time that you receive your textbooks, and I show you how to use Canvas so that you will be able to get in and do your schoolwork. So it's really important that you're here for that orientation. All right, the medical assistant portion of the program includes lecture and lab and your 2 weeks of externship. It covers topics like medical terminology. You're going to do some pharmacology, psychology, anatomy, physiology. You'll be given some injections. You'll also learn how to do stitches, take stitches out, do staples, take staples out, and a little bit of billing and coding will come along with it. You will take a certification exam by the National Health Careers Association, the NHA, which is accepted by our area. It's 150 questions, and you'll have 3 hours to take it. And you will be prepared to take it by the time the test time comes. The phlebotomy technician will include lecture and lab. You have to have 30 venipunctures for certification. That's why I send you to the lab to get those. Most students get it in 2 days, maybe 2.5 in the lab, depending on how many patients they have. You'll learn how to do venipunctures, dermal punctures, processing labs, special collections that happen in the lab, safety and compliance. You'll take the certification exam through the NHA. There's 100 scored questions on the test, and you'll have 2 hours to take that exam. My phlebotomy technician exams have been 100% pass rate across the board. The EKG technician is lecture and lab. You have to do 10 EKGs. You learn how to do EKG monitoring, stress testing, vital signs, how to take care of the patient that's receiving the EKG. It is a certification through the NHA, 100 questions, 2 hours to take it. This is the more difficult exam to take. Not 100% pass rate with EKG. It is a little more difficult. But still in the 80s, the upper 80s, lower 90s% pass rate. Then you will get the personability, which are soft skills. And soft skills involve customer service, professionalism, critical thinking, all those things that make you more employable. These are the new things that employers are looking for. And you will receive a certification saying that you have completed a soft skills program, which is going to either make you more employable or it may make you more money because you have this certificate with you. It's a really cool program. It's something new that the NHA has done. It's online. It's animated people, and they teach you how to demonstrate professionalism. And then the little animated character is you, and you're interacting with the patient, and you have to type in what you want the medical assistant to say or how you want them to act, and then they'll let you know if what you said or did was appropriate. So it's kind of a cool little program that they have. It also counts towards your CEUs for your renewal of your certification. So these certifications that you get have to be renewed every 2 years, and you have to have continuing education to renew them. And this will count as 10 hours towards your CEUs. So you pretty much will have your CEUs done for the first year by taking this class. So the potential salaries. So I did some research in this area of what the potential salaries are for a clinical medical assistant. And the average is $34,200. Everybody wants to know what that is in dollars and cents. So $16.44 is the average salary for a new starting out medical assistant. Now, your salary is also determined by your education, your certifications. So you're coming in with 3 certifications, so that could increase your salary. Maybe you're already a CNA, maybe you're already worked as a PCA, and your years of experience. You know, if you've been working in Food Line and now you're taking this class, you're coming in as brand new. You're going to start off on the lower rate. But somebody that's been working in healthcare for years may start off a little higher because they've had some years of experience in healthcare. So the average is $16.44. As a certified phlebotomy technician, it's $15.96, and for an EKG technician, it's $17.61. Yes, ma'am. Yes. So these were the average salaries for Suffolk, Virginia, as of February 26th of this year. Okay, so, and that's pretty much where the closest areas are that you will find these medical assistant positions. Right now, our hospital here in Franklin does hire medical assistants. They have just started. So with the new purchase of the hospital, they are just now starting to hire medical assistants. So I was not able to get any data from the Franklin area, but Suffolk has plenty of medical assistants, so I was able to obtain data from the Suffolk area. So Suffolk and towards the beach, lots of medical assistant jobs. North of here, lots of medical assistant jobs. All right, so this class requires a commitment and dedication to complete work and meet the required due dates. The one thing that the students are finding out that are currently in the class is online classes are hard if you can't discipline yourself. So it's different than coming in and being in class Monday through Thursday, which is what we normally would be. And so normally, Monday through Thursday, we'd be in class for 6 hours. And then you go home with homework. Now you're at home, and you've got to try to dedicate that amount of time to your schoolwork. And that's difficult for people to discipline themselves. And so what they're finding is they're struggling only committing 20 minutes a day to a class that required 6 hours a day. So you really need to think about the commitment and the dedication that you're going to be able to provide to this program. It requires a 7-day commitment for 20 weeks. So it's about 20 weeks when you count the days off that you have for Thanksgiving and the holidays that we have in there. It ends up being a 21-week program. So for 20 weeks, 7 days a week, you need to open your book up and do something. Requires the ability to work well with others in small groups or large groups, because we will be doing the smaller groups. Be able to represent yourself when you're in public with a positive and professional manner. Finding these clinical sites is not easy, and so for somebody to go in and be unprofessional and then I lose a site will not make me very happy. Then we have to travel further distances to find sites to be able to practice our externships. I try to get them close. Requires you to be flexible and patient, especially with me, because technology can be challenging to me at times. So you have to be able to be flexible and patient with the instructor. Requires you to be excited and eager to start a new career in healthcare. So this is something that I am very passionate about, something that I really enjoy doing, and I want students that are going to be just as excited as I am about the class. I have seen this class change people's lives, and I have a couple examples that I like to give. I used to work with a lady that worked 3 to 11 at one of the assisted livings, and she had an 8-year-old son and a brand new baby girl. She'd been working 3 to 11 for years. So when her son started going to school, she wouldn't see him. You know, she'd go to work before he got home from school. And then when she got off of work, it would be 11:30, 12 o'clock before she got home. So the son was going and staying with different family members during the week while she was working. Then she had the baby, and so she would see the baby a little bit during the day while she was off, but then she would take the baby to a different family member to keep the baby while she worked 3 to 11. But she wouldn't want to go pick the baby up because the baby would be asleep, so she would get the baby the next morning. So all this time away from her kids, and she decided to take this class. And right now she's currently working in a doctor's office. She works Monday through Thursday. She works 10-hour days. And she's off every Friday, Saturday, and Sunday. So she's home at night with her kids. She's home on the weekends. Doctor's offices aren't open on Christmas Day. Doctor's offices aren't open on Thanksgiving Day. So she's able to spend holidays with her children, and it has changed her life for the better. And it has changed her children's life for the better because she's able to be home with them. I just had a Facebook post the other day of a student that was in my class from 2019. When she was in my class, she was a single mother, had a little cute baby girl that she even had to bring to class sometimes because we couldn't find a babysitter. She was living at home with her mama, didn't even have a car. Since then, she got a job as a CMA, she has a car, and she just posted at the beginning of this week holding the keys to her new place. All because she got the job as a CMA. And I think she's making somewhere around $17 an hour. So this class has been life-changing for some people. It's put them back in the workforce. It's made them be able to do some things that they wanted to do, which keeps me coming back teaching time after time. It's very fast-paced, and you need to be ready to hit the ground running. The first 8 weeks is lots of work to do. Then it kind of calms down a little bit, then it gets busy again, and then it calms down a little bit, and then you're done. It'll be over before you know it, but it's a very busy, fast-paced class. Then here's some information. That's the number to the Workforce Center. That is my email address. You can email the reference letters to that address. You can email any questions that you have. And then that's our address if you want any of your reference letters to actually mail in the reference letter to the Workforce Center. All right, let's see if I get these lights back on for us. I have two papers I'm going to give you that we're going to go over that include a timeline and a class schedule. I used to give these out before we got started, and everybody spent all their time looking at these. So let's look at the timeline first. So on this timeline, you've already completed the first thing. You came to the information session. The next thing, you have to pick up a packet. Now, I understand Linda won't be here till this afternoon, but Linda Riddick at the front desk is who has the packets. And I think they said she'll be here at 1 o'clock today. Otherwise, I would say call the Workforce Center and see if she's here, or let her know that you want to pick up a packet, and she'll leave you a packet. But by April the 16th is the deadline to apply to the program. So you have to pay your $30 fee. You have to complete your registration form. You have to complete your background check. So your background check, please note that the background check has to be notarized. That is something new. So on the top of it, it asks you to fill it out, and then it asks for your signature. Do not sign the background check until you're in front of a notary, so that they can notarize your background check. Then you have to provide a valid picture ID, and you're going to sign a permission form to give the college permission to process the background check, and you'll sign up for an interview with me, and you will get your letter for your drug screen collection. So by April the 16th, you have to turn in your application, your background form, pay your money, and sign up for interview. Okay, and pick up your drug screen form. Now, the drug screens are done at the Now Care in Suffolk. That's on Godwin Boulevard near Oversea. We chose there because it's the cheapest. It's only $25 there. Everywhere else was $40 and $50. So $25 at the Now Care. You just show up with your letter from us, your ID, and $25. You sign in. You tell them you're there for a drug screen. You give them that information. They'll send us the results. Now, if you turn this page over, by May the 7th, you have to have all of your information in. So we will have run your background check by May the 7th, and we'll have that in your file. Your drug screen should be in the file by May the 7th. So that means don't wait till May the 6th to go get your drug screen done, because it won't be in your file by May the 7th. Your reference letters need to be in your file by May the 7th. What happens is that following Monday, they hand me the folders, and the first thing I do is go through and check off that you've got everything, and I put those people in a pile. People that are missing stuff go in this pile, and I'll get to them after I finish with this pile. So you want to be in this pile that I'm starting with. So you want to have all of that stuff in. On May the 13th, a selection will be made for who has been accepted into the program. And on the 14th, acceptance letters, they'll be emailed to you first. And then they'll be followed by a letter in the mail. So when you get that, it will give you all the instructions that you need about signing up for a registration session and all that information that I showed you about what to bring, your tax forms and all that good stuff that you need to bring with you, and registering online for the Workforce Center. All those instructions will be in there. And it'll also tell you that by May the 21st, you need to be sure that you call here and accept the seat. That's real important, and some people forget that. What I would recommend is go ahead and call, accept the seat, okay? I had some people say, I didn't call and accept the seat because I didn't know if I was going to get funded. You can always decline the seat if you don't get funded. But I would recommend going ahead and accepting the seat. And then if something happens for some unknown reason you don't get funded, then you can say, well, I can't do the program because I can't pay for it. Okay? So don't wait for finances to decide whether you want the seat or not. If you want to take the class, accept the seat as soon as you get the email. June the 25th by 4 p.m. is the deadline for your registration packet to be complete. That is the registration packet that has to do with finances. So whether you're working with Virginia Career Works, the Out of School Youth Program, Miss Wolf, whoever you're working with that's completing your registration packet, that is due by the 25th of June. July the 8th is when the tuition deadline is due. So for those of you that have gotten funding, the vouchers will be sent to us by July the 8th. If you owe any money, it has to be paid by July the 8th. And then July the 15th is your mandatory orientation. And day group and evening group means whichever one you decided to do your skills. Yes?
That one, does that have to be in Franklin or Suffolk?
Say that again.
Do we have to be here in Franklin for this, or do we come to go to
Yes, so that the mandatory orientation is here for both groups, right here in this room. Okay? But then after that, if you're in evening time, you'll do all your hands-on in Suffolk, at the Suffolk campus. Not the Suffolk Workforce Center, the Suffolk campus of Paul D. on Kenyon Road.
Are they the same times?
Now the times will be scheduled with the instructor.
Okay.
Okay? So right now, I'll give you an example. Right now, the daytime group is with me, and we are doing Tuesdays and Wednesdays 9 to 3. So my group picks whether they want to come on Tuesday or Wednesday, one or the other. That way we can split them up. I have 7 on Tuesday and 7 on Wednesday, so we can social distance everybody. And they're here from 9 to 3. The evening group, they are on, I think they're on Monday and Wednesdays. And so they pick either Monday or Wednesday, and they are 5:30 to 9:30,
Okay.
I believe is their time. But she may have to adjust that because she's going to be coming from Franklin. She works at the hospital in the operating room. So she's going to be coming from Franklin to Suffolk.
Okay.
So she'll have to figure out what her time frame is going to be depending on her work and which days she's going to offer. So we'll know that by the time you get to orientation, and we'll know which days. So then you'll have the opportunity to pick which day you want.
Okay, thank you.
And then on the 19th, the classes begin. Any questions about the timeline? All right, the next form that I gave you is just a schedule so you have something to go by as far as dates are concerned. Now, we don't go by these days and times anymore because now it's all online. But the medical assistant, the whole bundle is from July the 19th to December the 9th. And then we finish out the whole thing on the 10th. But the actual class period is from the 19th to the 9th. And then we do 8 weeks of medical assistant, and then we stop and we start EKG. And from September the 13th to October the 7th, for 4 weeks, we do EKG. At the end of that, you actually sit for your EKG certification. That following Monday, we start phlebotomy. So if it's anybody in here that's just doing phlebotomy, you won't come in till October the 11th. From October the 11th to October the 28th, we'll be doing phlebotomy for 3 weeks. At the end of phlebotomy, you'll sit for your phlebotomy exam. Then we'll come back together for medical assistant. You'll be given your clinical assignments. And then there are 4 weeks that are set aside for externships. You won't attend all 4 weeks, but I need 4 weeks to be able to place everybody where they need to go. So for an example, the first 2 weeks you might be in the doctor's office. The third week you might go to phlebotomy Thursday and Friday, and the fourth week you may not have anything as far as outside of your house. You'll still have work to do, but you won't have to go anywhere to do it. And then we get together for one last week where we finish up everything, and then you sit for your medical assistant exam. And then we graduate. Now the externships, just to keep in mind, they are Monday through Friday, 8 to 5. Is what they typically run. So keep that in mind for those of you that work, or those of you that have kids, that you need to make those arrangements. Yes?
For 2 weeks?
For 2 weeks. We will give you plenty of notice so that you will know exactly when you need to do that. So I can tell you it's going to be around the November, the month of November. It ends up being like around the first or second week of November up until, actually it's the whole month of November. Yeah, it'll be the whole month of November, I just don't know which 2 weeks. But if you tell me my boss says I can be off this 2 weeks, then I can work around that, okay? I can write you a letter saying that this is what you're doing if you need that. Some people need that for short-term disability or just because their boss didn't believe them that this is what they're doing, so I can do that for you if you need. You just have to let me know. I've done it many times for people. But that is something that people need to make arrangements for, because that is something that you have to complete. So you have to think about that. I had somebody tell me the other day, well, I have to take my kids to school and then I have to pick them up by 3 o'clock, and so I'm going to have to work in Franklin. And I said, I told you this at the beginning, that you got to make these arrangements. I'm sorry. It's 8 to 5. I don't have any control over that, and you got to do it for those 2 weeks. So you're going to have to make arrangements for somebody to get them to school and pick them up for those 2 weeks. Now, I'll try to work with you the best I can, but you really need to try to make arrangements for that. All right. Questions? Yes.
So just to be clear, we're not doing everything all at one time?
No.
Okay.
No. So when you start off for your first 8 weeks, you are doing medical terminology and medical assistant. Everything is online. So I have pre-recorded all my lectures. I have videos there for you to watch. I have all your assignments already loaded on the computer with the due dates. So if you want to watch your PowerPoint at 3 o'clock in the morning, that's up to you. Okay? So if you want to be 2 weeks ahead, that's up to you. Okay, so you work it like it works for you. There will be times, so when it's time for me to show you how to use the NHA, okay, because there's the study material for your credentialing exam. When it's time for me to show you how to use that website, once I get you registered, I will have a mandatory meeting. I will send out an email to everybody and say, we're going to have a mandatory meeting, and it's going to be at 9 o'clock in the morning, 4 o'clock in the afternoon, and 7:30 at night. You pick which one of those times is good for you to come. Okay, so that will give you an opportunity to see which time is best for you. Then you come into Zoom, and I will share my screen with you, and I will show you what you need to know. Then there will be times before a test that I may say, Friday morning at 9 o'clock, I'm going to have a study group. If you can come, come. If you can't, it won't be held against you. Maybe Sunday night, I'm free and I can do a study group, and I'll send you out a message that says, I'm going to do a study group Sunday night at 8 o'clock if anybody's available. Those type of things are, if you can come, come. If you can't, that's no big deal. But the mandatory meetings are meetings that I need to share some information with you. And then we can have one-on-one meetings if we need to. If you're not understanding something or you need to meet with me, then we can either have a phone conversation or we can set up to have a Zoom meeting so that I can share stuff with you and we can talk face-to-face. And then once we get into the skills lab, that's where we do a lot of our face-to-face talking. That's where it's been a lot of face-to-face, because once we get into the hands-on, then we get to see each other. And you can get a lot of your questions answered. So you can't go online, you can't do blood pressures online. So all of that we actually have to put our hands on. So that's why you'll come, and it's not every week. So like the first, with medical assistant, it's 6 weeks. Then you get a break, and you'll come for 3 weeks. And then you'll get a break, and then you'll come for 2 weeks. So it's not every week for 20 weeks. It's in segments that you'll come and do your hands-on. But you'll get a schedule at orientation. And that schedule will tell you exactly what days you have to be there.
So, question, for this time around, do you think the evening class will be pushed back a little more or pushed forward? Because the 5:30 would be great, or later, because I work till 5:30, so I was just curious about that.
I'm thinking it's probably going to be pushed back because, like I said, she works in the operating room here in Franklin. So she's going to need drive time to get to Suffolk.
Yeah.
So I'm thinking it's going to be somewhere between 5:30 and 6 o'clock that she's going to need to be able to get there. And then we'll just have to work it out as far as hours are concerned. So, you know, as far as hours, so I said, you know, we do 6 weeks and then we get a break. Well, the evening may have to do an extra week to get the hours that they're missing because they're not doing the same amount of hours that the day group is doing.
Got it.
Just because y'all don't want to be there until 11 o'clock at night.
Thank you.
Other questions?
So the soonest that we can get our drug screening is the 16th when we get our letter?
Yeah, whenever you go and pick up your packet with your background check and pay your $30, you can get your drug screen letter.
Okay.
So like I said, she just told me a few minutes ago that Linda wasn't here till 1. And if I had to guess, the packets are not up there yet
Okay.
until Linda gets here because she usually handles those.
Okay, so we don't have to wait until the 16th to...
No.
Okay.
No. The 16th is when you have to have your $30 paid back.
Oh, okay.
So between now and the 16th, you need to pick up your background check, your drug screen letter, and pay your $30.
I got a question.
Yes.
Who would pay the $30 to? Is it to you guys or?
Yeah, you're gonna pay it to the workforce center, and we don't do any cash here anymore. So it would have to be a credit card. I think they do a money order, but I know they do credit, they just don't take cash anymore. And yeah, you can do that in the front office. And you can even call in, if you need to call it in, they will take the payment over the phone. Yes?
I returned my packet in, but I didn't complete it all. Like, I got it notarized, but I didn't do the drug screen.
Okay.
But I gave you the money for the background.
But for the background check, okay? I would just call and just touch base with Linda,
Okay.
okay? So between now and the 16th, you need to get that application, get that the background check, that drug screening form, and pay your $30. And then she will create a folder for you if she hasn't already. Some of you, she's already created a folder for, and everything that you do will go in that folder from here on till you're accepted into the program. So if you happen to get your immunizations and you're up here and you want to put it in the folder, if you have your high school diploma and you want to put it in your folder, any of that can go in your folder.
We can make a copy of the diploma. Okay.
Yep.
But the packet will have the list of things that we need.
Yes. Well, as far as when you get your letter of acceptance, it's going to have everything in it that you need. It's just, I put it in the PowerPoint so people can start thinking about things that they need, because that's the biggest thing is people get accepted to the program and then we're waiting on people to find tax documents or find paycheck stubs or find SNAP letters. They're calling social services trying to get a copy of their letter, and that's what the holdup is. And right now, it's not as big a deal as when the pot of money is running out and everybody's competing against that pot of money. But the quicker it gets done, the faster things get turned around. We were like, at the very, like the Friday before class started on Monday, with people getting their vouchers in. Like, people weren't sure whether they were going to start on Monday. And we don't want that to happen.
No.
That makes it stressful for me and them. All right, if nobody has any questions, I appreciate you coming, and I look forward to seeing you again. And email me if you need anything. Call the Workforce Center. Miss Linda is great to work with. This is her baby. She loves to help you all get prepared for this program. She's really, anybody can answer your questions, but she's really the go-to person when it comes to getting the stuff you need to get into the program. All right, y'all have a good day.